Hello, today we will be discussing on how to set up our patients for lateral cervical. First, we will need to do our patient preparation. We will need to go out into the waiting area, find our patient, and call them back to the room where we will be taking their images. We will need to introduce ourselves, state we are taking their images today, and ask them for their full name, date of birth, and last menstrual period if needed. While doing all this, we will need to check their wristband to correctly be able to identify our patient and know that they are exactly who they say they are. We will be needing a image receptor size of a 10 by 12 cassette. Our image receptor orientation should be portrait, and our image receptor location should be at the wall bookie. Our SID for this image will be at 72 inches or 180 centimeters. Our patient position should be where our patient is positioned in the lateral position with their shoulders up against the vertical image receptor. Our part position should be where we ask our patients to relax and drop their shoulders down and forward as much as possible to allow us to see the cervical spine. Our central ray location will be horizontally with C4. Our central ray angulation will be perpendicular to the image receptor. Our collimation for this image should be approximately 1 inch of space anterior and posterior of the cervical spine and anatomy of interest. A visual marker location for this image should be either in front or behind the cervical spine, so long as it does not show in the anatomy of interest. Our KVP for this image should be approximately 75 KVP. Our instructions for this image to our patient should be that we will need to have our patient do full expiration, which means they should take a deep breath in and exhale all the air out. Hold their breath, do not move, and to drop their shoulders and hold still for the exposure. The anatomy demonstrated within this image should be the cervical vertebral bodies, intervertebral joints, spinous process, and the zygapophyseal joints. Our items of profile should be C1 through C7 and T1. The bodies of the vertebra should also be free of superimposition. Pathology that is best demonstrated within this image will be pathology involving the cervical spine, the adjacent soft tissue structures, degenerative diseases including spondylosis and arthritis. That is all we have in how we should set up our patient for lateral cervical.